I'm with Dr. Scott King of OSS Health. We're here for our OSS Health tip of the game. Today, we're going to talk about ankle injuries. This is an area that is very close to my heart because for years, ankle injuries just plagued my sports career, and that was years ago. But Dr. King, you have a greater insight. You see athletes all on a regular basis. Talk about what you're seeing in your office and what's going on today with ankle injuries.
So ankle injuries are the most prevalent or the most common thing that I see, both on the sidelines in our urgent care. We see ankle sprains, on a frequent basis. And sometimes, it's a first-time ankle sprain. Right. Patients usually do pretty well with that, with ice, anti-inflammatory medication if it's indicated, and relative rest, and then some strengthening exercises. But certainly a good portion of patients have recurrent ankle sprains, and that's where it becomes more difficult to treat because then they start losing more and more time in play. So the big key, if you do sprain your ankle, is immobilization, whether it's taping, an ankle brace, something along those lines when you do return to sport for a period of time. But I think what's overlooked a lot is, rehab, ankle strengthening exercises, because patients will get weakness, they'll get swelling, and that's going to cause you to have a more lax ankle, more susceptible to recurrent sprains. So doing ankle strengthening exercises, whether it's with your trainer, whether it's with a physical therapy, is really, really important and has been, shown over and over again to lower your risk of having a recurrent ankle sprain and having recurrent injuries to your ankle.
Now, is there a certain length of time that you would say, hey, just take this long of a break before you get back into action, or is it all riding on how the rehab goes?
There's definitely grades of sprain, like grade 1, grade 2, grade 3 of ankle sprains. And, then you can bring in high ankle sprains too, which generally can take longer to recover from. Usually people need, athletes need a couple weeks, 2 weeks to return to sport. And that's usually the earlier end, the earlier side of it. It can certainly be 4 to 6 weeks, but I really make it patient specific because I have different levels of patients with different levels of sprains, swelling, and pain. So it's just based on, whenever that athlete is ready to return and their pain level is tolerable, they can return.
Guys, you've heard it from Dr. King from OSS Health. Ankle injuries are common. Those are some great tips for families at home. I know I'm going to use some of them, especially with my kids.